Hello, ladies and gents. Welcome back to another discussion about our mental health. Today, I will be discussing about mood disorders. And mood disorders are simply mental health illnesses that affect our emotional state. And they are kind of different from mood swings. So, people who have or who experience different mood disorders might experience long periods of sadness or happiness or even both. They might experience emptiness, they might feel empty, they might feel lonely even when they're surrounded with people. There might be this feeling of worthlessness and some others which will be discussed later. So, how can we differentiate between mood swings and mood disorders? So, mood swings usually are short lived. They are just, they just occur and it doesn't last long, while mood disorders last longer from 2 weeks, 3 weeks, months, running into months. Also, anybody who is experiencing any mood disorder would there will be changes in their behavior because of the change or the effect of the disorder or the illness on their emotional state. It's also important to note that it's also going to affect their productivity, So these three things are the ways we can differentiate between mood swings, mood disorders. One, mood disorders last longer than mood swings. There's going to be a difference in their behavior, and also it's going to affect their productivity. It might also affect relationships and all that. So there are different types of mood disorders, and the very common, very popular one is depression, the major depressive disorder, which a lot of people call common name is depression or clinical depression. However, there are different forms of depression, but generally speaking, depression, one of the signs of depression is the feeling of emptiness, worthlessness, low activity level, low energy levels. They lose interest in their normal activities. These are some of the basic signs of depression, and it can last between 2 to 2 weeks into months. Another mood disorder is dysthymia. Dysthymia is kind of like depression. It's more or less a chronic um, depression. However, it's milder. It's milder and it lasts longer. That's why it's chronic. It lasts longer. It can last up to 2 years. And the onset is earlier. So this person experiences low energy. They are not very motivated. They kind of prefer to isolate themselves. To some extent, most of the time, because the onset is early on in life, dysthemia's onset can usually be as early as adolescence, even early childhood. So some people might just think that, okay, this is the kind of person they are, or maybe they just have a personality disorder, that kind of thing. So, but this is dysthemia. Dysthemia is a milder form of depression, but which lasts longer, it's chronic. Unlike major depression episodes that last like for months and then they might bounce back or they can bounce back. Dysthymia lasts even on 2 years, like 2 years, 3 years, 4 years on a stretch. So that's the difference between dysthymia and major depression. Another depressive disorder is bipolar. Bipolar is where this person experiences extreme energy levels, their extreme excitement, they are just everywhere. Even their behavior is different, the way they talk is different. And then a few minutes later or a few hours later, you see them energy levels very, very low, behavior just changes, you know, they start they now begin to behave like the typical depression, traits that everybody knows. So there's this kind of fluctuation, and sometimes for some people, like for family members who don't really understand, it can be confusing. However, with bipolar, there might also be periods of manic episodes where they might even become aggressive. And there might also be hallucinations, that seeing and hearing things that are not there. There might also be delusions, that's beliefs, expressing beliefs that are not realistic. So another mood disorder is premenstrual dysphoric disorder. See grammar. Premenstrual dysphoric disorder. This kind of mood disorder is special to women. You've heard it, premenstrual, but it occurs usually before menstruation occurs, like between 7 to 10 days prior to menstruation. So the person begins to, or the lady begins to experience maybe intense irritability, insomnia, maybe anger. But after, or let's say even before the menstruation, they begin to feel better, or in some cases after menstruation, they begin to feel better. So, some women usually say, when they have seen their period, or when they're about seeing their period, they become irritable, things begin to irritate them, they get easily angered and all that. So, the name is premenstrual dysphoric disorder. You can go and read it up for more info. So the next mood disorder is disruptive mood dysregulation disorder. This is characterized by intense anger outbursts, usually in children. This is specifically for children, and it usually begins before the age of 10 in children. So it's where the child is not able to manage their their anger, and the anger outburst is usually out of proportion to the cause of the anger. We know we expect children to throw tantrums, right? However, the children who have disruptive mood dysregulation disorder, the anger, the outbursts, the tantrums are usually, excessive, it's out of place. And, you begin to wonder, is it this little thing that is making this child to, you know, get so angry or to throw so much tantrums. So this is very, very peculiar to children and starts very, very early. So it's something parents also need to watch out for. It starts as early as before 10, So parents need to watch out for this also in their kids. Apart from these major mood disorders that I've also mentioned here, mood disorders also can be triggered by um, ill health conditions, especially chronic illnesses like injuries that a person has to, intense injuries, like serious orthopedic conditions, and chronic illnesses like cancer, diabetes, you name it. So the person might begin to experience depressive symptoms as a result of the ill health and circumstances related to the illness. Then there are also mood disorders that are triggered by the abuse of drugs, um, alcohol use disorders, and even depressive episodes that can also be triggered as a side effect of some prescribed medications. So apart from the other um, disorders, there are also people who experience mood disorders that are not generic to these other groups I mentioned. So they might either fall on this other side now, people who abuse drugs or medications, or people who have this disorder as a result of illnesses, other physical illnesses. So that's it and done. In the next video, I'm going to be discussing about the treatment, the causes, and people who are vulnerable. How do we know who is vulnerable to experience mood disorders? So that we get to know and maybe know what to do. How can you prevent? How can you protect yourself from experiencing this? What can you do about it? I hope this video made sense. If it did, don't just listen and like, also share it. Thank you very much.